So as I said, segmentation is the most important part for a radiation oncologist, and I'll show you how it helps. And offline planning or online planning is something which our physics department will be doing it. I'll not be concentrating more on that. So we have already spent a day in the morning learning about what is deep learning and what is machine learning. Let me show you how it works for us. So these are the images which are fed into the system. I have to contour the liver here. So the system, this is a two-step algorithm. The first step, it will locate where the organ is, and the second step, it will contour by itself. So what we have to do as a human, as an oncologist here is to check whether the machine has done a proper job or not. So for example, these are all our own images. And this was the initial rectum which we planned during the first day of radiation. But we see that there is a little bit of gas in the rectum. If there is too much of gas, we cannot go ahead with the treatment. We'll ask the patient to step down and pass the gas and again go for the treatment. But this amount is acceptable for a radiation oncologist. But you cannot just go ahead directly with the planning, because this area will be showing as if, because if you do not draw the target, the system will not show the dose which is exactly received by the tumor, by the critical organ. So after immediately with one single click, this is how the automatic deformation will help us with the proper contouring of the rectum. Only a little bit here and there, a millimeter or less than millimeter part of the rectum might be missing, which can be easily corrected. But with the deep learning technology which is yet to come, that will also solve these even minimal problems also. So maybe the time will come even faster. And these are the seminal vesicles. So not only the critical organs, we see that there will be some amount of movement in the critical organs also. The seminal vesicles were to be treated, but they have been pushed down because of the bladder filling there. So we applied the deform registration, and you can see that it has almost all done. 90% of the job is done. A little bit part is left. So this is where the human intelligence still stays along with artificial intelligence. And we have been actively participating in a lot of national and international studies, and we are happy to present all these papers and our work which has been presented across all the international forums. Planning I have already told. And as of now, for the past 2 years, we have treated more than 500 patients. Around 20 patients are treated per day, and majority of our patients are bladder and rectum. You can see in this case, the uterus literally dances. If you have to treat this patient, you have to almost all cover the entire pelvis to treat this cancer for the radiation. But now we have the automatic registration which helps us to contour, and you just give a small margin around to prevent any further delays, and that's how we can reduce the treatment doses. So earlier with the IGRTs, I'm not talking about the cobalt machines and other machines. With IGRTs, we used to treat around 1600 cc of volume, and that has now come down to almost all 40 to 50% reduction in the normal tissue volumes have been reduced. Also in the post-op settings also, we could see that almost all 10 gray, that is 1000 centigrade of dose to the normal structures, if we can reduce, just imagine the kind of side effects we can reduce for these patients. The vestibular schwannomas, where you can see very clearly the tumors and prostate tumors. I think in the interest of time, I will stop here. Even the small lung tumors also, you can track them while they are getting treated. And if at all, if it is passing out of the target, then we, the beam will be automatically switched off. And there is a lot of future which is going to happen in this field. And brachytherapy is one area where we'll get all the automatic segmentations, everything for brachytherapy also. And all our patients have been used for those. Our data has been sent to these companies who are working on these things. Thank you so much.